media. Now we'd like to take questions from the floor.
Please identify your media affiliation before raising questions.
Journalist from the right side.
Thank you. With China Net.
With,
For the people above 60 years old, whether it's suitable for them to get vaccination. Right now, we have different standards for different localities. Some localities are allowed, but some places don't. So, do we can we have a unified standard for the people above 60 years old? Whether the NFC can issue a document in this regard?
老年人群的健康防护一直是我们在整个的新冠疫情防护中的一个重点。按照新冠疫苗接种的总体的安排和部署，我们对各类人群的接种都做出了一个相应的一个详细的一个安排这里面呢，也其中包括60岁以上的老年人。前期我们对于有接种需求，同时呢身体状况呢比较好的老年人，开展了接种工作。这个接种呢，我们是参照对于重点人群的接种来进行实施的。
To be vaccinated, but this based on the category of a key target group identification. Based on the clinical trials, in terms of the efficacy and security, we have come up with specific and designated vaccination plans. In order to further implement the vaccination work, including vaccination for the people above 60 years old, the working group formulated a technical instrument for the group of people above 60 years old. We have raised a series of unified suggestions for inoculation. And we will give further instructions for different localities in order to further protect our elderly people. Thank you. CMG CCTV, regarding the situation in Guangdong, we don't know whether you have a calculation to say whether the infected people already vaccinated. If yes, that means that the current vaccine is not good enough to protect us. Thank you for your question. Right now, the local outbreak, we have seen that. First of all, the vaccination efficacy is not 100% based on the data we have. Some people also infected by the virus after vaccination. That doesn't mean the vaccines don't work. We talk about protection rate, we talk about efficacy. First, you need to be vaccinated. And if we have the immunity population reach to a certain stage, then that is inducive to curb the spread of the vaccine, to curb the spread of the virus. That is why we encourage people to get your shots in order to reach the herd immunity, to lower the infection rate, to lower the fatality rate, and also the rate of the severe cases. That is why we would like to see more people get vaccinated. And also at the same time, we should keep a close eye on the efficacy of the vaccines, and also to look at how long the vaccines can protect people. So with sufficient data on hand, if needed, we can improve the immunization plans so the vaccines can play a greater role in protecting people. Thank you. With People's Daily, and people are quite concerned about the coronavirus outbreak in Guangdong province. Would you please elaborate on the latest information on whether the situation is getting better? Right now, the students already finished their entrance exam for the college. Do you have any suggestion for them if they would like to take a trip to other places? Since May 21st, the outbreak in Guangdong happened, and so far we have more than 100 confirmed cases, and we found that the cluster infection cases normally happened in the family. So the epidemiological investigation showed the similar features. So the reported cases right now coming from the close contacts or the lockdown or restricted places. Right now we haven't found any other a linked case happened in other provinces. And within Guangdong, we only found a limited number of cases across different places, but we should say that we found a very clear evidence to say why the case happened in other cities within Guangdong province. And also the Guangdong conducted very strict measures, including the travelers and the airport and the train stations in port. And also for the people living in Guangdong or Foshan, they also shortened the valid NAT from 72 to 48 hours, and also discourage people conducting unnecessary trips. Based on the disease prevention and control measures taken in Guangdong, we believe that we will flatten the curve, but we will for sure will see some of the sporadic cases reported. But overall, we look at the whole society. Besides the medium and high risk areas, for the other places, it's safe for people to conducting travels, but that doesn't mean that we should lower our guard. For the people with a plan for celebrating the Dragon Boat festivals or for the grade 12 students, you need to learn the latest disease prevention and control practice in your destination cities, and also please protect yourself during the trip, wear masks, and also keep your hand hygiene, and also keep social distancing. And during the travel, if you found any symptoms like fever or coughing, please go to the nearby hospitals or the fever clinics. With paper, and we see that infected cases right now, we found the youngest one is 3 years old. Do you have any plan for the vaccination to this younger group? Thank you for your question. In order to protect people's health and safety, a large population vaccination policies would follow the principle in a prudent manner. The plan should be based on the epidemiological investigation, the vaccine efficacy, and the safety. So far, the inoculation work in China for the people above age 18. Although it's allowed for people between age 3 to 18 to get vaccinated for the urgent reasons, based on the momentum or trajectory of the pandemic and the feature of the certain age group, we will make a comprehensive studies with experts to come up with a vaccination plan and policies for the specific group of people. And we will also work with relevant departments to implement the vaccination for the adolescent kids. With China Business Network, for this time, the outbreak in Guangzhou showed the new features compared to the previous outbreaks in other provinces. Does it mean that we undertook a new stage of the routine COVID-19 protocols? Thank you for your question. The outbreak this time happened in Guangdong. Actually, was started from Delta, or the variant first found in India. And according to the naming principle made by WHO, so this the Delta.
And the data has been updated. We have a better understanding on the level of communication as well as other features. According to the current features and the current statistics, we have seen that it has a very strong communication. And among the several VOCs, it has the strongest communication compared with the other variant. It has 100% of increase of the communication compared with alpha variant, and its communication has increased by 40%. So based on the features of these times of the pandemic, we have seen more cases among the senior, and we have also seen cases because of people are gathering together to eat and etc. It has also have a very close relationship with the lifestyle. For example, Guangdong people tend to have breakfast together, especially among the seniors, and it actually has a higher requirement on the vaccination rollout and containment measures, because previously we have a comparatively low vaccination, and till now Guangdong has been taking very tough containment measures, and things are moving to the positive track, and it has been getting much milder. Actually, since we have normalized our containment measures, we have seen the resurgence of the local diseases. According to our origin tracing, based on the pathologicals and other things, we believe that it is all related with the imported cases or the imported objects. So our risk is still above the prevention of the imported cases. So we are still under the containment normalization of the prevention of the imported cases, as well as the prevention of the resurgence in the infections. And we have already seen more than 30 different outbreaks based on the causation by the overseas imported viruses. As we have seen the cases of and outbreaks in Guangdong, Liaoning, Anhui, Yunnan, we can see that our containment measures are very effective. We would have to implement all the containment measures based on the guidelines of the normalized containment measures. We wouldn't be able to slacken our vigilance. We would have to wear masks, wash our hands, keep the 1 meter distance measures to enhance our monitoring. Whenever we find a cluster of cases, the local governments would have to take very swift measures to take on the investigation of the pandemic. Usually, the virus and the pandemic would have been controlled within 1 or 3 incubation periods. So we would have to take more measures to have effective control of the important cases by active vaccination rollout and other measures. And next question. Thank you very much. I'm from CCTV. We have already seen that we are considering of expanding the vaccination to more age groups. Currently, till now, do we have any progress on our domestic produced vaccination? We know that the inactivated vaccination from 2 producers domestically has been allowed to extend the age group to 3 years old in emergent cases. Thank you, Mr. Shao. Actually, at the very beginning, our vaccination would only be applied to the age group of 18, and the oldest who have been vaccinated has exceeds 100 years old. We have already had a vaccination rollout of more than 800 million. In such a very large scale of the vaccination rollout, the statistics has shown that the vaccination in our country is safe and effective. And the Beijing Institute of Biological Product and Sinovac, their inactivated vaccination, after being applied to the adult and after the approval by the NMPA, and they have a conditional market launch being approved. On the basis of that, they have extended the group to 3 to 17 years old in their second phase of the clinical trial. Such data has been accumulated and presented to the relevant government institutions. After the assessment by the experts, it showed that it is safe among the age group of 3 to 17. All such results has showed that the antibody has been generated, and based on the current pandemic dynamics and based on the approval of the governmental relationships, the Sinopharm, Beijing Institute of Biological Products, and also Beijing COVID inactivated vaccination under some special urgent circumstances can be used for the vaccination aging from 3 to 17. In the future, based on the changing landscape of the pandemic spreading and also other things, we would do a better job in the monitoring of the vaccination upon all age groups, including the specified age groups of 3 to 17. Next question. We have noted that in Hubei, Qianjiang, there are several people coming back to hometown has a slight positive result in their NAT, and it is because of contamination when being vaccinated, and it is not infectious. And how do you regard these types of positive results because of the contamination of the vaccination? How are we going to prevent it?
Mr. Wang Huaqing is taking the question. The inactivated COVID-19 vaccine has been prepared after the cultivation of the wild virus and inoculation and other processes. Because the full virus has been inactivated, therefore it is no longer infectious or pathogenic. However, the genes are still kept. Therefore, during the vaccination process, like the opening of the vials, the extraction of the vaccine liquid, or prior to the vaccination, exhaustion has been implemented to prove the gas tightness of the syringe. All these practices may lead to some contamination. That's why we may see a test result of a slight positive in NAT. However, it is no longer infectious. How can we ensure that there is a lower incidence of the positive test result because of the contamination during the vaccination process? We have issued policy circulars and put forward the following measures and recommendations. First, we should try to minimize the accompanied people, ensure the standardized approaches of vaccination and the whole process. And during the vaccination process, those who are vaccinated and those who are accompanying the vaccinees, they should go through health screening. They should properly wear masks. The vaccinating institutions must have a proper control of the medical disposables so as to minimize contamination. Inactivated vaccines of COVID-19 is not infectious. The general public doesn't have to be worried about it. But even if there has been some positive results or false positive results, we have ways to know very quickly whether it is because of infection or some of the substandard practices of vaccination. Next question, please. With the China Youth Daily, I have a question for Director Cui. Netizens have the timetable that by the end of June, we will have vaccinated 40% of the population and 70% by the end of the year for a quick establishment of herd immunity. What should be our arrangement? Mr. Cui Gang is taking the question. Thank you. We follow the basic principle that those who should be vaccinated must be vaccinated. We have been following a tiered and prioritized step-by-step approach in the vaccination program. On the previous press conferences, we have briefed the journalists on this very issue. We have been focusing on 2 points: key populations and key places. Up till now, vaccination program in China has been steady, orderly, and has been moving ahead according to schedule. As Director General Mi Feng has mentioned, as of yesterday, we have administered 845 million dosages, covering 625 million in our population, one of the top in the world. Going ahead, on one hand, we should continue to maintain this high level of vaccination coverage. We will continue to focus on the key populations and the key areas. Besides, on the other hand, we will continue to roll out the coverage on other segments of the population so as to enhance the overall coverage of vaccination, and more of the people will be protected. Thank you. Next question, please. Thank you. With the Phoenix TV, we've noticed that the foreign media, it still is again giving attention to the possible lab leak from the Wuhan Institute of Virology. What is the take of the National Health Commission? Thank you for your question. China has been supporting the global origin tracing efforts. We've taken the lead in working with the WHO to conduct a joint origin tracing research. China WHO joint COVID-19 origin tracing experts panel were composed of the top-notch scientists from around the world. They jointly worked out the work plan, worked out the work research, and released the research reports. In June 2020, WHO has sent experts to work along with Chinese experts, and they've jointly worked out the terms of reference. In January and February 2021, the joint experts team conducted research in Wuhan and convened a press conference on the 9th of February, and on which the major conclusions were announced on that press conference on the 30th of March. A foreign experts team convened its press conference, and on the 31st of March, just in this room, the Chinese experts team convened the China's press conference to jointly announce the report conclusions. The English version of the joint research report has been uploaded and released on WHO website, and the Chinese version can be found on National Health Commission's website. The conclusions from the China part of the origin tracing research report is very clear. One is that it is highly unlikely that the virus has been the result of a lab leak. I like to emphasize that the origin tracing of COVID-19 virus is a scientific issue. It must be worked on by collective efforts from global scientists. Origin tracing is a global task. China would like to call on all parties to cooperate with WHO for origin tracing in an open and transparent attitude. Next question, please. With the cover, we've noticed that one nasal spray of COVID-19 vaccination has applied for emergency use. What are the specific features? Many say it is first time for them to know there is such a formula. What about its protection and effectiveness? Mr. Shao Yiming is taking the question. Nasal spray vaccines or inhalation spraying vaccines are one of the products following the 5 technical pathways deployed by China. Some institutions have been conducting the research and development of this new type of nasal spray or inhalation type of vaccination. The first and second phase of clinical trials have been conducted. Statistics have been collected. Experts have been organized to review the safety, the immunogenicity of the vaccinations. Going ahead, we will continue to evaluate its efficacy in the 3rd stage of clinical trial and emergency use. The the E-type adenovirus vector IM vaccination co-developed by Madam Chen Wei, the Military Science Research Institute, and Casino Biologic Products Company have passed the 3rd stage clinical trial in overseas clinical trials and is now qualified for the use. Inhalation vaccination has the same formulation, only the way of administration is inhalation rather than intramuscular injection. The nasal spray of the influenza virus carried COVID-19 vaccine co-developed by Wantai Company, Hong Kong University and Xiamen University have completed its 1st and 2nd stage of clinical trials and is now in the application for the 3rd stage clinical trial results to prove its efficacy. We are familiar with the injection type of vaccines. It is also the most dominant type of vaccines. However, for nasal spray or inhalation, the muscle's immunogenicity has been activated by using this formula. I'd like to add another point of comment. The Chinese nation has been the first nation in using vaccination to prevent infectious disease. It was as early as the Song dynasty. We had been using the bean sprouts. We have refined those bean sprouts and used the inhalation way for inhaling the powders of the bean sprouts to inactivate the immunogenicity in the human body by way of muscus immunogenicity. For the nasal spray or inhalation, the administered content is only 1/5 of the injection. The raw material and the API use is only 1/5 of the original formula. given the short supply of the raw materials, we can enhance the immunogenicity in the upper respiratory tracts and meet the world needs of vaccines. Thank you.
Many of those who have been already vaccinated for the first dose began their second dose. Do you have any suggestions? A question for Mr. Wang Huaqing. Thank you. As you know, for the vaccination to have a better protection efficacy, such a whole cycle of vaccination is a necessity. We have 2 doses and we have also 3 doses of the vaccination. I believe to complete a whole cycle of the vaccination is of prime importance. I would like to stress those who have already got the first jab, according to our guidance, would have to finish the following doses. For the inactivated, you would have to finish the second dose, and for the protein subunit, you would have to have the second and the third doses. So no matter it is inactivated or protein subunit, you would have to finish the whole cycle. I believe the prerequisite for the vaccination to have its efficacy is untimely and to finish the whole cycle. I would like to also stress after the first dose, if you have very serious allergic reactions and if it is confirmed that it is caused by the vaccination, then you shouldn't be further vaccinated. Hong Kong. Based on what we have seen for those who have already infected, what is the pathogenicity of this round of the variant, and what types of protection effect do we have for the vaccination? Mr. Feng Zijian. From the current infection, the Delta, which is originated from India, it has a feature of very high viral load and short incubation period. So it has a very shortened incubation period, as we have already observed. Within nearly 10 days, it has been transmitted for 5 or 6 generations. So compared with the previous variant, we have seen accelerated pace of the transmissibility. And also among the infected, we have used BC2 to conduct the test. It has already shown that the viral load has also been on a significant rise. However, internationally and domestic researchers have shown that this new variant, it has some immunomutation. However, current vaccination are still having a quite sizable effect on it, because according to our observation, among all the confirmed cases, the severe cases proportion among those who haven't been vaccinated is much higher than those who have already been vaccinated. So it means those who have been vaccinated are still protected even against those variants. Even though we have only selected a few samples, however, our observation is highly in line with the overseas researchers. So we have observed very similar patterns. So currently, our priority is still try to enhance all containment measures, including all kinds of non-immuno intervention measures, as well as accelerating the vaccination rollout, taking a comprehensive measure to cut off the transmission from Guangdong. Thank you very much. So the last 2 questions. Please continue. From Zhongxin. For those group who have been vaccinated for over 6 months, do they need to have a third jab, or do they need to be revaccinated? Have we already conducted a certain research in this regard? A question for Wang Huaqing. Thank you very much. NHC has issued the new edition of the COVID-19 vaccination technological guideline has made it pretty clear that for the inactivated vaccination, there should be 2 doses, and the interval should be ranging from 3 to 8 weeks. Based on the current procedure, we have based ourselves on the comprehensive clinical trials, immunogenicity and protection effects, as well as epidemiological features. All these measures have been taken into a comprehensive account, and it has been decided that the 3 to 8 weeks cycle in space should be a right one. After the vaccination, the decreasing of the antibody level doesn't mean that it doesn't have protection anymore. We need to conduct further research in this regard on the relationships of the protection and that of the level of the antibody, as well as the functionalities of the immunomemory enhancement. The priority for us is still try to set up the herd immunity as soon as possible to eliminate the immuno divide. That is why it is a necessity for us to improve our vaccination coverage. Whether we are going to have enhanced immunization and how are we going to conduct it, we need to have sufficient evidence, and we also need to conduct more research in this regard. Such evidence should be obtained to see whether we need to adjust our immuno strategy. Actually, immunoprocedural is the core of the immuno policy. We would also need to see whether the changes currently would have effect on the subsistence of the immuno effect, as mentioned by my colleague, that whether the variant will have a certain influence to the protection effect. And also, if we want to have a third enhanced jab, the safety would also need to be assessed. Only by having sufficient evidence can we be entirely sure whether we are going to have an enhanced immunization or whether we are going to conduct enhanced immunization. Thank you very much. Last question. I'm from Shandong. Currently, Guangdong is still quite pressurized by the imported cases from overseas. What types of experience will Guangdong need to learn, and how Guangdong can do a better job in containment measures?
Thank you for your question. For each spike of the COVID-19, in particular after the surges in local cases, we had been conducting the origin tracing. We have also been conducting the in-process and after-response evaluation so as to learn lessons, gather experiences so as to better respond to the local transmission and provide more effective and targeted measures to intercept domestic transmission. For this round of Guangdong or Guangzhou surges, we had been looking to whether the first case that had been identified was indeed the first case and what was the reason of her infection. We got certain clues. We have been following the clues to verify the clues. Once we have confirmed the results, we will definitely know whether it was because of the imported variants of the viruses and why it had triggered domestic transmission, what were the loopholes, and how should we make up for the loopholes so as to guard against similar events in the future. Besides, the timeliness of identifying domestic cases is quite important to carry out timely and immediate responses so as to intercept further transmission. For this round of the Guangdong surge, this Madam Guo, if indeed she is the first case, that means we had very timely and quite early on identified the case. After the identification of the cases, we've carried out an array of measures, including the survey, the epidemiological survey, the tracking of the close contacts, and the close measures adopted in communities, the NAT screening, and we've further zoned the key populations and key communities. We need to assess whether this zoning and this classification had been sufficient or had been overdoing. We had been continuously evaluating all these efforts. It had been difficult because on one hand we must block the transmission as quickly as possible, in particular for such big metropolitans in Guangdong province where there is a big population and people love gathering together for many of the recreational activities, including catering. And on the other hand, we must prevent over-controlling, which may hamper the economic and social life or interrupt or disturb the economic and social life. So how can we make a balance between the two sides over the epidemiological survey and the public health measures in response to the 30+ earlier cases? For each case, we have been pondering over all these aspects. I believe given a little bit longer of time, we will have a clearer understanding of the gains and losses from this process. Thank you. I'd like to thank all the guest speakers for taking questions on the recent epidemiological updates and vaccination. Tomorrow will be the Dragon Boat Festival. Whether you plan to embark on a journey or you want to stay put, please be compliant with the control measures. We'll continue to brief you on future press conferences to answer your concerns. With that, we conclude today's press conference. Thank you.